So cirrhosis, this is a irreversible, chronic, progressive degeneration of the liver with fibrous and areas of nodules of regeneration. So there are different types. There's one that is caused by alcohol. There's one that is post-necrotic, which is associated with viral hepatitis or exposure to epotoxin. One that is biliary cirrhosis is associated with inflammation or obstruction of the gallbladder. Remember that bile is stored in the gallbladder, and if there's some backing up, then it can then affect the liver. Then we have cardiac cirrhosis is associated with heart failure. So nodule liver with fibrous and scar. There is shown to be a destruction of the hepatocytes and even killing the tissue, which is the necrosis. Necrosis nodules and scar tissue obstruct the flow of blood, lymph, and also bile. And then you have an impaired bilirubin metabolism that can occur. So what finding can you see? Weakness, fatigue, weight loss, hepatomegaly, which is enlargement of the liver, upper right quadrant pain, jaundice, itching, dysuria, which is decreased absorption of fat and fat-soluble vitamins, clay color stool, increased bilirubin in the urine, producing a dark color urine, impaired aldosterone metabolism due to edema, impaired estrogen, gynecomastia, menstrual changes, even body hair, vascular changing, and even spider angioma will be noted. Impaired metabolism of protein and carbohydrate and fat produce less plasma protein, resulting even edema and ascites. Ascites, accumulation of fluid in the abdomen. There produces less protein needed for clotting, absorb less vitamin K, which results in prolonged bleeding, liver failure to convert glycogen to glucose, resulting in even hypoglycemia. Remember, when we eat, the excess sugar is stored into the liver as glycogen. When we're going through a fasting period for whatever reason, then the liver turns that glycogen into glucose. But with cirrhosis, that can't happen. That's as an impairment. So the person will end up in hypoglycemia. So for liver function test, they'll test the liver enzyme, which is the ALT and the AST, and also the alkaline phosphates, the protein thrombin time, complete blood count. They'll check even cholesterol, because there's two ways that the body gets cholesterol. The body gets cholesterol by re-eating food, and it gets cholesterol from the liver naturally. So with the liver being affected, cholesterol need to be checked. It will be decreased due to the impaired liver synthesis. In addition, serum bilirubin and urine bilirubin should be checked. So they will do endoscopy retrograde cholangiopancreatography, which is called ERCP. So they're looking at the gallbladder, they're looking at the pancreas, and they're looking, that's what this does. It examine the bile duct and look at all those areas that may be involved. They even may do a CT scan of the liver and maybe even a liver biopsy. So management, steroids for post-necrotic cirrhosis, replacement of vitamin B12 and fat-soluble vitamin. In terms of diet, increase carbohydrate. Protein may be restricted depending on the amount of damage there is to the liver. Possible sodium restriction with complication due to the ascites, and also 2,000 to 3,000 calories daily. And they should not do any intake of alcohol. They may have portal hypertension, ascites, hepatic encephalopathy can even occur. So for nursing intervention, they want to monitor bleeding, any form of alteration in nutrition. You want to promote adequate and optimal nutrition, instruct the patient to avoid any kind of alcohol intake or any kind of even Tylenol. Tylenol can affect the liver. They should not even take Tylenol if they have cirrhosis. Manage any itching and maintain skin integrity. Provide bed rest period. Client will not tolerate strenuous activities. Remedy knowledge. If they have any knowledge deficit, you want to educate them. You want to manage for loss or level of consciousness, because if you have ammonia level building the body can cause confusion and change in level of consciousness. Avoid any kind of sedation. Manage any itching, because it's the liver and they may have excessive bile in the blood. It can cause itching of the skin. Monitor any fluid balance. Measure abdominal girth because of the ascites. Daily weight, and measure intake and output.